All right, it is February 2nd, 2021, Groundhog Day. It certainly feels like Groundhog Day.
Groundhog Day?
Uh,
It's been a groundhog year.
Year, I feel like. Kind of in the repeat. We want to get to the numbers for you. We want to welcome you into Coronavirus Inside the Arizona Numbers, where we try to help you make sense of some of these numbers so that you can make the best decisions for your family and your life. I'm Katie Rammel, alongside me here, Garrett Archer, and we got a lot to talk about today, a lot of vaccines. Let's hear some good news, Christina's saying. How about I give you some really good news right off the top here? We've got more doses coming in. I just posted about it on my Facebook page. So many more doses coming in. I believe, was it 21,000 they just said, Garrett?
Yeah, let me just get to it. Give me 2 seconds and I'll just bring it up on Twitter. This was tweeted by the governor just a few moments ago before we started the show, saying that tomorrow, as you were saying, let me see if I can get a little closer. AZDHS is opening up registration for 21,000 more COVID-19 vaccination appointments.
Perfect. I put some more information on my Facebook page too. If anybody wants to sign up, you can find that at News from Katie, and it's got the details on what time and then when those dates are available for. I'll go over it with you real quick. Of the 21,000 Garrett just mentioned, they open tomorrow officially to book Wednesday, February 3rd at 9 a.m. And those appointments are available from this Friday, February 5th through Thursday, February 18th, between the hours of 7 a.m. and 5 p.m. So you'll want to go check on their site for that information. So go to the Arizona Department of Health Services and you'll find that there. You can find all the information that I just posted over on my Facebook page if you want a little bit more. So 21,000 new appointments coming in. And by the way, scroll through my post because there's 2 others on there that are open for the next 2 days. So I think there's one in Mesa and then there's one in Goodyear and Chandler pods with information on how to sign up for those on that site. So the more people that can get vaccinated, the closer we are to this better situation and some better news and all that, Garrett. We were learning today that the CDC has said that we have more people vaccinated here in the United States than we do in all the cases. So we had 26 million people infected with COVID-19, and we've had 26 million, and we've now matched that with vaccinations given out. So you look like you're typing. You're about to show something else. Do you want to go to the summary page, or
yeah,
do you want to show us a little bit more on that?
Check something because I wanted to check something on that particular data point.
Okay.
What I think is the total number of doses. So yes, so 26 million people have received, right? 26.4.
Yeah, 26 million. Yes.
Okay. So important caveat on that before we move on. And I'll just go to the page. This is from the CDC. 26.4 million have received 1 or more dose. This right here, 6 million have received the 2 doses, the complete series. So while we have 26.4 million that are they're basically in the process of being vaccinated, whereas 6 million of those, so 20 million people have 1 dose essentially, and 6 million have both doses.
Right. And that equates to 8% of the United States getting that initial, and then that 1.8% getting the full dose there. Correct. So worth noting in all of that, obviously, we want to get bigger numbers vaccinated to get closer to this. Everybody's not liking our t-shirts today. I'm sorry, we're both in black t-shirts. We used to dress alike all the time, and we didn't. It was always on accident, Garrett. Now that we're both in black t-shirts today, everybody's laughing at our shirts. So sorry.
It's a solid. What can I say?
Sorry. Yeah, solids. Yeah, the pattern's too noisy. Okay, so we got to those numbers. That is the good news. And some people are saying, no, there's no openings. There are openings, Marie. Jump over there right now if you're over 65. So you got to be in those groups. Information we talked about right at the beginning of this, or you can find it over on my Facebook page. 21,000 openings starting at 9 a.m. tomorrow morning. All right. Okay. We say all that good news on the heels of some disappointing news in the number of deaths that came out today. A pretty high number plugged into that epi curve, and we can talk about now what is the highest day in all of this. It's very recent, and then our sheer numbers today. So how do things look today?
So today, 2,938 cases were reported by the AZDHS, 238 deaths. Now, what does this mean? Our case numbers are falling very quickly right now. 37% decrease week over week on the case numbers. As far as the number of, and that actually puts our 7-day average for cases is now 4,600. While that sounds like a lot, it's important to note that just on the 25th, so what is that? Last week,
Yeah.
8 days ago, it was 6,900, it's almost 7,000. So we've dropped by nearly half on the number of cases that we're reporting on basically the same day. So something very, that's very good news. Now, as far as
Hmm.
the deaths, they have not dropped. And we if you've been watching this program for a while, we've been talking about this. The deaths were not going to drop when cases drop, and that's what's happening. Our death number 238 was the sixth highest that we've ever reported in the state, and it actually obviously increased our 7-day average, which is now 130. At the same time frame on the 25th, it was 140, and it went up to 170 the next day. So we could still be seeing some higher death numbers in the future.
Hmm.
Now, because this dramatic drop in cases, and we're seeing drops in hospitalizations as well, the good news, I guess, is that the death numbers are going to run out of steam pretty quickly here, and we should be able to report much lower death numbers going forward. So I'm going to go to the deaths tab really quick and show you what you're talking about. So we have a new day of the highest number of deaths during the pandemic, and it's January 18th, very recent. In fact, it just had several added today, and which means we still have a growing curve, and it's at 145. If we look at the weekly data, we can see that our highest week so far was January 3rd at 922 deaths, followed by January 10th at 886 deaths. Now, this right here, January 17th, it only says 752. I expect this to increase, though. I don't think it's going to get to that 922 any longer. I believe that it'll probably go up to somewhere in the 800s. And again, as we go forward on, we should start seeing even lower numbers here. So hopefully we'll be out of this 800 deaths a week and into sort of 500, 400 as soon as possible.
So that's drilled down by week. You could also split that apart to show us the date, and that
Yes.
Date of death that we've seen the most death in the life of this pandemic in Arizona is actually coming now in this winter surge, as opposed to
Yes.
July in the summer surge.
Yes, and the thing to remember about this number is that while this looks like a dramatic decrease, a lot of this data hasn't been filled in
Filled
yet.
in. Mhm.
And so the fact that this is so recent means that there's still some potential for it to continue to grow, and indeed some of the days after this to continue to grow and possibly even surpass this. I still believe that we are at the tail end of any sort of surge in deaths, but I don't know when it's going to end. It could end this week, it could end next week, but we're getting to that point where we should start seeing this number go down.
Yeah, obviously we're thinking of all those families as well as we report on this. We focus this broadcast on the numbers and helping you understand all the numbers that come out of this, but we always pause to remember that there are families behind every single one of these numbers and a person that is deeply loved. So pause to say that, and I want to answer some of the questions. Ray's asking, less testing, that would mean less cases, wouldn't it? Are we having less testing at this point? And does that mean fewer cases?
So let me see what our testing numbers are here. And let me pull up my. I'm going to pull this down really quick, and let's go to that number. Just give me a few seconds.
Mm-hmm. I'll answer Marie's question really quick. Let's see. I just saw another post from Marie. If you're trying to get somebody over 65, you can get in at those state-run sites, Marie. And I saw you posting that you called this morning and there weren't any. This is breaking news that was just released. It's 9 a.m. tomorrow morning that those 21,000 spots are available. If I may, Marie, I'm going to give you a tip right now. If you haven't gone and signed up for your login already, sort of created your portal in there, do that now so you're ready to go right at 9 a.m. tomorrow morning. I heard from a lot of people when these opened up on that Tuesday a couple of weeks ago that they're saying, I can't get in, I can't get my password, I can't get set. Do that all ahead of time so you're ready to go and choose your slot tomorrow morning at 9 a.m. So hopefully that helps. We hope you can find a spot. Again, this is for the over 65 group and anybody in that priority 1B or 1A group. Okay. Were you able to get it?
On the testing, less tests means less cases. Absolutely, there is some truth to that. Although let's go over these two graphs right here in the top. I'm going to start at first. While there has been less testing, this is the test graph. You can see it decreasing here. It is not decreasing at the same rate that the cases are. The reason that is this graph right here, the positivity rate, and you can see this is the line I want you to focus on, this sort of greenish line. You can see it reached a peak of about 26% positivity rate in early January. It is now down to about 18%. So while we are doing less testing, we are also getting a lower positivity rate right now, and that is the trend that continues. I have not seen that turn yet. As of right now, the positivity rate is going down as well.
Yeah. So if you're needing a test, we haven't talked about this in a while, you can sign up for a test on the Arizona Department of Health site. You can either do some of the saliva tests or the deeper nasal test. There's the site, producer Carrie adding it to the screen for you, so you can go get signed up. It seems like we're not getting requests about that as much to find out where to sign up. People have kind of either learned from friends, but I just want to stress that again, that's where you can find that. Those sites are still available. Katie's writing, today we can see Garrett's zip code map with the color differences showing where we're hit harder and doing better. Are we able to go to that next?
Yeah, we can do that.
Sure. Katie, your request is we'll fulfill it for you right now. And there's a couple other questions we'll get to as well. These are really good questions today, so we'll try to make room for them. And Ray, I hope we answered your last question there. What is the website? Paul is asking, what is the website to sign up for vaccines? It's pod.vaccine.azdhs. You're making me think here. .gov? Is that what we decided?
Yeah, .gov, yes.
Okay. Had to look for a second. There we go. There it is up on the screen. Sorry about that. Okay, so that's where you should go. Sign up for that portal before 9 a.m., Paula, tomorrow morning. So go get everything set so you're ready to go, and you can just click in. And Ray's saying, yep, he got his question answered. So,
okay, so this is our zip code map. I'm going to take it a little easier to see, take out some of make it a little easier to see here. So here we are on the zip codes. I know you can't really, you can kind of see where the freeway starts. This is the 10 freeway. This is the 17 freeway. I'll walk you through some of this if someone has questions. The highest zip code it looks like right now is this zip code 85264. That is, it looks like it's just outside of Fountain Hills. So it is I believe that is a tribal zip code. It is there's very few people in there. It is Fort McDowell. That is a tribal zip code. Fort McDowell, there was a very high spike in cases per 100 in Fort McDowell. Not a lot of people live there, of course, but it went from 327 to 1,200 just in there, just in 1 week. But aside from that, most of everywhere we're seeing declines now. You can see, I usually start down here at Queen Creek, and you can see it's gone from 961 to 720. And most of that in the East Valley, it's the same in the East Valley. You're seeing numbers going down all across the East Valley. These have always been a little lower. You can see some increases in the North Valley, but they were already fairly low numbers anyway. Well, low for where we are right now. Here's one that went in half, 85054. Went from 685 to 398. That's
wow,
in half. Let's head over to the Southwest Valley. You can see we have some that are 85043. This was another one that was very big, and it's gone from 1,300 last week to only 750 this week. And 85009 from 1,000 to 800. 85051 from 957 to 855. So there's still some lingering. Everywhere things are going down, but it seems if you look at these numbers, they're going down faster in the east and in the southwest portion of the valley. Things are still fairly high and not going down at the same speed. Now, this, of course, is a concern. We know that this is a lower income area. This was an area that was hit hardest during the July pandemic, and it seems that it's going to take hold and stay here longer than it is in the suburban areas of Phoenix.
Yeah, this is such an interesting map that helps us to get a better perspective on how things are going. Katie's saying, thank you. So easy to read. It is. And we owe that all to Garrett. He designed that map. So thank you, Garrett. A really interesting question from Michael. How many vaccines are given per zip? Do we have the same map?
We do not.
I was going to say that information.
Yeah, I've been asked this question multiple times. I totally understand. It's a question that everybody wants, but we simply do not have vaccine information outside of anything but county. That is the lowest we have right now. And it's all I can do. I wish I had zip code. I wish I had anything, but I have nothing.
Yeah, it's a really good question, Michael. Thank you. Brenda's saying, I'm a senior with no car. How can I get a ride to get a shot? Well, first of all, on February 11th, Brenda, this is going to be some better news. The government is sending vaccines right to pharmacies. There are 6,500 pharmacies that are like on day one going to have this, and then it's going to expand and get bigger to so many other pharmacies. And the idea is that most people in the US live within 5 miles of a pharmacy, so that will be closer to get there. I have been feeling so hopeful just by people posting on my Facebook page saying, I want to go to State Farm Stadium. I just don't even have a ride there. And literally other viewers on my page are so wonderful. They're reaching out to each other and connecting and sharing rides over there, which I just find that to be so hopeful and so awesome to see Arizonans coming together like that to make sure everybody can make their way over there. But so the directed vaccine program, February 11th is the start date for that. So some exciting news there. Also on the reimbursement front with our National Guard troops, they're getting reimbursed. The states are getting fully reimbursed for our National Guard troops that have been out there, and also anything that we've spent on it for masks, for gloves, and for the National Guard since January of last year. So January of 2020. So some better news on that front too, as far as the funding goes for all of this. Okay, so the vaccine numbers, we likely won't get any more specific than that county level.
There is a chance. So we were told a while ago that they were going to attempt to, let me make sure I have the right date here. Yes. So we were told a while ago that they were going to try to get a dashboard up for vaccines.
Right.
And I don't know if that's going to be just a county dashboard or something that has a little more oomph to it, if you will. We don't know anything, unfortunately. I don't even know how they're collecting this data. So, you know, with all of the other data, the COVID-19 data, we know how they're getting into the system. It's almost, they've basically taken a medical billing system and converted it to a COVID-19 tracking system. I don't know if they can do that with the vaccines because I don't think they're billed to health insurance. I don't know how it works. So I don't know if they're collecting the same type of data. Obviously, they have data with a lot of people signing up for accounts and everything, but I don't know how they're going to put that into a dashboard. I simply don't know yet.
So what we can share with you is how these look, Michael, by the county. So here's where you can find this on the AZDHS site. It's split apart based on the vaccines that are ordered. You're going to see that 1.2 million or almost 1.2 million down there that have been ordered, the 702,000 that have been given out. That then splits into 579 initial doses and 109 complete. So they've gotten their full set. So that's kind of how things shake out. If you want to check this out, this is probably the closest you can see. Oh, thanks for sharing my question. He writes, teacher, looking to return to a safe, reasonable, and responsible environment. Yes, Michael, we want you to be safe too, and all of our teachers as well. So hopefully, I'm wondering if they had a vaccination site for you guys at the school too. We've seen a lot of, and we've covered a lot of schools doing that. But this is worth pausing on just for a moment, Garrett, to show everybody where their county is as far as priority. If they're in, everybody's in 1B, some form of 1B. Nobody's in 1C. Obviously, if you're in 1A, you can still go get vaccinated. You didn't miss your shot. But the slanted lines mean that they are taking
65 plus.
65 plus in that group.
Yeah. So here's where we are. So counties. So pattern indicates county vaccinating 65 and older. So all of them in 1B. But no, it's Carrie. I'm sorry. It's 65 plus. Not 60.
She's saying 60 plus. Not there yet.
Yeah.
And unless you are a teacher or in one of those priority groups of a firefighter, police officer, something like that. So.
Yes. So we will, it looks like Katie, I'm just going to go back really quick, with 702,000. We add about 37 to 40,000 vaccines a day to this total. So it looks like by what, today's Tuesday? So Thursday, we should have more people who have gotten at least their first shot in Arizona than who have tested positive in the state as well.
So this is fascinating. So we were just talking about that being the case for the entire United States. And what you're saying is Arizona will be matching that soon.
Yes, very soon. Absolutely.
Well, that's better news, at least at this point. Oh, thanks for the great information. You guys rock. Thanks for joining us on here. We appreciate that. Your cute little pup there, adorable. Okay, so we've got these groups, and you can see where they are. If you're under 65, that's probably the question I'm getting most is from people who are in that like 55 to 65 age group. You're just not up yet. That the group hasn't been called yet, and that's probably been one of the biggest frustrations besides people just having trouble with the site and signing up on there. So that's where you can find that if you want to take a closer look. We pretty much update you each day, but we're not here with you the rest of the week. So if you want to find this information, you can find it on AZDHS's site. It is a little bit buried. You're going to have to go on there where it says find vaccine and click on that tab, then go down to the bottom. It's going to split it out by county. So a couple of steps in getting to that actual graph on the page. That's why we always make sure to have time with it. Some of the happenings around the valley being postponed. It's happening again. Country Thunder postponed. If you need a refund to that, you're going to have to go online and do that by Friday. So I want to make sure everybody knows who's hoping to get a refund for their tickets. That's happening. You got to go online to do it. You got to do it by Friday. But once again, Country Thunder postponed. Garrett, you look like you're about to say something.
Oh, no. I was looking through some things. Sorry.
All right.
Nope.
The other thing I want to mention is we're going to have a really interesting story at 5 coming up about the heart damage related to COVID survivors. And that's coming up in our 5 o'clock newscast. So I just wanted to pass that along to many of you who might want to join us for that conversation as well. As many of you know, focusing on heart issues has been something that I have done for a long time here in Arizona in my work here at ABC 15. And it is a month where we focus on heart health in February. So we'll have that story coming up tonight at 5, important to discuss. So we hope you join us for that. Another thing of note, to-go alcohol sales. That was put off for a little while, and they're applying for special permits for the state. Garrett, have you taken part in that? Not to put you on the spot. Have you gotten
alcohol sales?
A to-go margarita or something of the such?
No, I have not.
It's one of the...
If I'm going to make a margarita, I usually just buy the supplies.
Oh, okay. All right. You're such a DIYer. Yeah. I'm tired, and I would like to get a burrito and also pick one up. And 8 other states are looking at putting that back in play, as well as Arizona. So we'll let you know if that stays. Listen, Mama's working hard right now, and sometimes, just one, I would like to have a margarita. Okay, so let's get... Candace is laughing about it. Send him over, Candace. I need one at this point. Okay, so let's get to some of these hospitalization numbers. We were telling everybody about the better news that was happening in the state of Arizona as these numbers were dropping. Is it something that we can still count on in all metrics for hospitalizations, or are there only a few that are looking as hopeful?
No, all metrics are going in the right direction right now. So we'll just go through them really quick. Today was the first day that the ICU headroom was under 90% since, I believe, November 30th, I think is the day. Yes.
Wow.
November 30th is the last day we had more than 90% headroom in the ICU. And you can see that is due to a drop in COVID-19 patients. It does appear that we're getting close. We're not quite there. So the ICU numbers do go slower, as we've talked about. So we're not at the point where the ICU is over 50% non-COVID. We are there with the inpatient, which is the general acute care. We're already in a situation where there's more standard patients than COVID patients, 3,513 COVID-19 patients today. That's down from 3,600 yesterday, 4,200 standard patients with a headroom of about 10%. Expecting to see this one, we're not really expecting to see these numbers. Usually, as you can see, when we look over here at these headroom numbers down here, usually they don't start dropping until sort of the bottom end of the curve, because there were so many people that were waiting for surgeries and hospitalizations that they tend to keep the hospitals at a more full rate for weeks following the drop in COVID-19. So we're expecting to see that. Now, emergency room, this is just all emergency room, but it's a good indicator of what's going on at the hospitals. You can see it continues to decline slightly. The hospital COVID-19 metrics. This is just basically seeing what we've already seen. Over a 30% drop in inpatient and ventilator use is. I'm going to go over ventilators in just a second. So I'm going to stop with the ventilators right now in the ICU. Moving to the discharge, huge drop in discharges. It's really, I mean, we're talking from just 787 to now 579. Same thing with emergency room departments. It held over from yesterday, but this, as you can see, this is usually a very noisy graph, and it's not being really noisy right now. It's quite literally plummeting. And then also intubations is also down to 92. So let me stop this really quick. I'm going to bring up one graph that's my own graph. And this is basically to show you why we're having higher death numbers continue, even with these numbers of hospitalizations that are dropping. So I'm just going to go over some of these are a little easier to read. I do apologize. They're internal graphs, so they're not really meant for broadcast, but I'll go over them anyway. This is an index. Oops, sorry about that. That's my fault.
I was like, that looks very similar.
Yep. I had to go to a different window. Okay.
No worries.
Okay. So this is an index of all the hospitalization numbers. So I put them on the same graph. So they're on. So no matter, obviously with inpatients, there's thousands more bed than ICU. So this basically indexes them, puts them standardized so we can see what they look like. And you can see that inpatient and emergency room visits are dropping at the same rate, whereas the ICU numbers are dropping at a slower rate. They're just not going down as fast as inpatient and emergency room visits. So, and these two graphs basically show that this orange line is the COVID-19, the green line is the non-COVID-19, and this is the headroom. And you can see the headroom beginning to increase. Same thing here with the ICU, the headroom beginning to increase. This is the graph I want to stop on today. This is a new graph. I just put it together today. This is the ratio of COVID-19 ventilator use to ICU patients. And the reason this is important is we know by the data that most people, unfortunately, if it gets to the point where they're on a ventilator, the chance of survival at that point gets very low. And one of the reasons why you can see we've had such high death numbers in January is that our ventilator use, our ratio between ventilator and ICU has been in the 70s. And you can see it popping up again. We really need to see this number go down in order to really start seeing the deaths go down. The deaths will still go down simply because there are less ICU patients that have COVID-19, but there's still a sicker group of patients. There's still 70% of those patients in ICU are still on ventilators. So we're unfortunately still in a situation where most of those ICU patients look like they're not going to make it out right now, which is very, very sad. But that's just what the data is telling us.
Because so what percentage of people in the ICU end up on a ventilator? Is that in there? Do we know?
It's about, as far as the COVID-19, as you can see, this is what it is on a daily basis. And it averages around 70% of people that are on a ventilator or in ICU for COVID-19 are also on a ventilator. It's very rare.
Yeah.
I have to talk to a doctor, but it's very rare because the ICU beds are specialized beds. They can handle a ventilator. Much harder to put a ventilator on a standard acute care bed. So the vast majority of the COVID-19 assigned ventilators are going to ICU patients. So we can take this and just basically extrapolate and assume that nearly all of these ventilators are going to ICU patients. And you can see that we're looking at about 70% here.
And that's something that we've never been close to running out of. At every point along this, it seems like we've been short on something, whether we're short on testing or testing agents or testing sites or ICU beds or hospital care workers. The one thing, and I would say maybe the only thing this whole time, has been ventilators. We've had enough.
We've never had an issue with ventilators from day one in this state.
Yeah.
And I don't know if that's because the federal government or the state government, whatever response they did, but the truth is we've never had an issue with them.
Yeah, that was never ever an issue. Yes. Okay, there is. Oh, Bill, thank you. Bill writes, thanks, guys. You've been the most informative I've ever seen anywhere. Thank you, Bill. Very, very kind. There's been some vaccine envy going on, Garrett, where people are seeing, and it's happening group to group, it's happening site to site, and in this case it's happening almost county to state. So the state sites are the two sites that have been set up. You can come from anywhere in the state and go to those sites, State Farm Stadium or Phoenix Municipal. Those are the 65 plus spots, and they were early on for the 65 plus group. And I know we're showing it on the news. We're flying our news helicopter over it, and we're showing these lines, and they're moving through, and everybody's getting vaccinated in the counties. These other counties are sitting there and they're going, what in the world? we're not getting anything, or it feels like we're not getting anything out here. And there in the big city, they're pushing everybody through and everybody's getting vaccinated. So there's sort of this envy going on right now. And we do have an update on what's going on specifically in Pinal County. Pinal County health leaders are hoping to open one of those vaccination sites in their area as well. Pinal County is saying that they want to open this up because people are watching these larger counties and have these state-run sites, and they're getting hundreds of thousands of doses. And again, they're saying what's going on here. So Pinal County is asking health leaders that they're currently in communication with, they're hoping to convince them to have a state-run site out there in Pinal County. So we have reporting on that coming up for you tonight at 5 as well, and the decisions made on that, because there is some envy going on, if you will.
And ironically, so Maricopa has one of the lower per capita rates for vaccinations in the state. Pinal County is right there with them. It's actually slightly lower than Maricopa County. I'm looking at it right now so the lowest in the state is Apache with about a vaccination rate of 45.25 per 100,000. But the next lowest after that is Mojave at, it looks like 5,800. But the next lowest after that is Pinal and then Maricopa County. So you've got two of the largest, so Pinal County is at 6,450. Maricopa is at 6,950. So we go to the next Pima County, and that's at 11,000. So Pima County is doing a much better job per capita of vaccinating its population right now than Maricopa. Now, obviously, Maricopa is massive compared to Pima County, but per capita wise, both of those counties are fairly low right now.
Yeah, so it's the discussion that's happening sort of behind the scenes with health leaders, and we'll continue to track it. We know so many of you are watching from that area, and we want to make sure that we address that as well. So that's coming up in our reporting this evening. Cameron Pullum's on that story. We'll let you know what the state ends up saying in all of that. They do distribute it by population, but hopefully the pharmacy rollout that's happening on February 11th will get more vaccinations to other sites, not just some of the bigger sites across the U.S. Israel's doing a good job. We've been sort of tracking that. They have 20% of their population already vaccinated.
Yeah. And I guess they're starting to see, like, they're seeing the effects now. I mean, people are putting out graphs seeing how Israel started really going up, just skyrocketing, and then they just vaccinate, and they're seeing just an immediate drop in numbers, and they're that to the vaccinations.
Yeah, it's really incredible to watch what they're doing there. I'll kind of continue to update you on the numbers out of that area. Diane's asking, when do essential workers get a vaccine? So Diane, if your employer has applied to be a part of the essential workers group, and you can read the list on the AZDHS site, I know the station has, as we're here at work too, we'd be in group 1C. So I'd be right there with you. It is a very, very big group. So I don't know how they're going to split this up or be able to get all these people through, but 1C would be the next one. Let's see.
I mean, as long as appointments are still filling up for 1B, we're not going to move to 1C.
They're not going to move on. I know so many people are still waiting for those, and we do have, of course, all of the 65 plus to take care of before we move on to 1C. Christina's asking, just curious, will ABC 15 do other stories aside from COVID related? Yes, and we can't wait to. We can't wait to. Trust me, we are so tired of COVID. It has been our lives at home and our lives at work, and it is our life all day. But we feel a real mission to help people understand these numbers so that they can still live their lives, but make the best choices to protect their health as well. So that's why we're here each afternoon, or we strive to be here each afternoon with you to help you better understand these numbers. And so to answer your question, for this purpose, this broadcast, this hour here that we spend with you in the afternoon is COVID related to the data specifically, to the numbers. So of course, yes, we get a brief break, but it feels like all things are COVID right now. My gosh. Okay, a few other questions I wanted to get to, and a few other things of note. The Super Bowl is obviously coming up, and there are other big events, not as big as we experienced, obviously, Christmas and New Year's Eve and Halloween and Thanksgiving and all these people getting together. But the Super Bowl is coming up, and they're giving out, they've just announced they're giving out PPE to a large number of the attendees. They're going to let 25,000 people in. There's conversation about whether that's the appropriate number. That could be discussed. Just reporting it here. 25,000 people going to be let in. 7,500 are those healthcare workers who have already received their vaccine let into the Super Bowl. But then that announcement coming today that they'll provide that as well. So Christine is also saying Valentine's Day too. Yes, and we actually have some information on Valentine's Day. They're reminding everybody to not share candy. So it's kind of like the same for Halloween that we saw. Just remember all the safety things that have been practiced throughout this last year, and please remember them through Valentine's Day as well. So we'll pass that information along. All right.
Kimberly asked a question, still wanting to know your thoughts on why testing has dropped so much. You know, I don't know, Kimberly. We don't know why the testing is. I mean, the only thing that we know is that you know, people aren't forced to test. So we saw a drop in testing as cases went down last time too. And I think it's simply because there's just less people not only getting COVID, but are getting in a situation where they believe that they're exposed to COVID. And so there's just less demand for testing right now.
Yeah. And don't you think we're all getting better on telling if something is COVID? Like, I feel more confident in my ability to read whether something's COVID. I remember I was sick in March and I thought, my God, I have COVID. Yes. You know, and now it's like, gosh, that was just stress or whatever.
When our household got it, I knew, we both knew we had COVID-19. It was no question.
Yes.
We both got the test just because, you know, I do since I work in data, I'm like, we should be part of the data points. But at that point, the reality is there was no question because we both had a sense of smell issue. So, you know, it was like, let's just, you know, we got tested, but I can see other households saying, there's no reason to get tested because we know we have COVID.
Or could you see earlier on in this getting tested because you thought, you know, I had a headache and now you're knowing there's a few other symptoms to watch for as well. So interesting. Yeah. Another theory, maybe a drop in testing since schools were closed. All these things could be absolutely. Okay. So I wanted to make sure I answered all the questions, but I also want to address two things that we ran out of time for yesterday that we were waiting for. And I can probably only remember one of them now because that's just the way my brain goes, being, you know, working and dealing with kids and all the things. You guys get it. We were going to look at the projections in the future. That was one of them we didn't have time for yesterday, and help people find maybe the most reliable site right now for where they can find that. Debbie's asking if your sense of smell is back. Is it back already, Garrett?
Yeah, absolutely. Yep.
Good deal. Good deal.
We're actually going to go to a special place today. I'm not going to go to IHME. I want to spend a little time with ASU, because ASU just released their new model, and they've done a very good job modeling. And I think we need to spend a little time with them today. So I'm not going to go through sort of more of the scientific assumptions. All I'll tell you is that we have three scenarios here. The current beta fit is basically where they think we really are going to be on. And then it's plus 10% or minus 10%, saying, okay, this is sort of the error bars, if you will, of what track we could go on. So as you can see with their total infectious persons, we do right now we're being, let's see, we're about right here. And you can see, you know, all projections have us going down as far as total infectious persons. We see this in hospitalizations. We see they also believe that the hospitalizations are going to continue to go down to anywhere from under 4,000 to just under 2,000. And what this line means is, I say, this is what we're talking about when the hospitals are going to continue to fill up beds. So that's why they just draw a straight line, because the hospitals will continue to fill up these beds no matter what. And then same thing with ICU. We see same numbers going down for ICU going up into March. The cumulative deaths, very little difference. This is a very high confidence at this point, where they believe that by the end of February, we're going to be in the 16,000 range for deaths. There's very little variance there. And then for projections of daily deaths, this is, you can see, you know, this is where they've been. Ignore this line right here, but this is where they think it's going to go. So they do believe that we are at the peak now, and that we are going to start seeing this drop pretty precipitously. And again, cases by test date going down. So ASU at this point, and this is their recovery. So they say about, it says about what, 20%, I think is trying to say. Projection fraction recovered.
Yeah.
So 20% of people that have it right now are going to get are recovered at this point. But this is basically what we're going with on ASU is they do believe that everything's going to be continuing on a downward trend.
Okay, so I need Barbara to come to the grocery store with me because she's reminding me zip codes was the other one. And I say the grocery store, Barbara, because I get there and then I'm like, what was it? What else was on my list? So we did already discuss the zip codes. Thank you, Barbara, for being the other half of my memory there. So projections to the future and then also the zip code map. Is there anywhere else that they can access that zip code map? I know that it is yours.
Yes, my browser has decided that it no longer wants to function, but if you go to gis.maricopa.gov/COVID/schools, you will be able to get on there and look at the information. I would love to share it right now, but my browser have just told me that it will not
work
share anything.
That's okay.
I'm actually surprised I'm still talking, frankly.
Oh my gosh.
But you know what? We're just going to, since we're 39 minutes in here, we're just going to keep with this and just move on.
Yeah, we only have a few minutes left. So does that mean you can't share your screen right now at all?
I unfortunately cannot share my
that's
screen.
okay.
Sorry.
That's okay. I do want to let everybody know where they can find us. Brenda was asking about the RT. Do you remember off the top of your head?
The RT was 0.80, I think it was.
Yeah.
Yes.
And remember that awesome site, Brenda's going away for RT.
RT.live. We cannot use RT.live anymore. So I'm going to move between. I'm still deciding which one I want to use. I think I'm going to settle on Epi forecasts.
Yeah.
But I still also use that MIT projection as well for the RT.
Okay, so we'll keep everybody updated on that. Really good question, Brenda. And Judy was asking about Yavapai County, and I don't want to leave you out. She's saying you haven't mentioned Yavapai County where there's virtually no vaccines. So hopefully, Judy, there's a couple of options. So she's saying my category is long past the first dose. So a couple of options. First of all, just announced within the last hour, there's going to be 10.5 million more doses per week sent out. Obviously, that's split between all the states and all the counties. But when that is split out, we're also going to have a 3-week heads up that it's coming. Before, we were only finding out a week before that they were going to have vaccinations. What that all means is that they're going to know farther out so that they can start plugging people in for a spot to then get a vaccination. The other option you have, if you really, really, really wanted to, and I don't know how far your drive is, but if you wanted to drive to one of the state-run sites, we talked about the 2 that are currently open. They're both in Phoenix. If you wanted to drive into that one to come in sooner, I know that's not ideal. That's just one other option. Waiting for the 10.5 million to be sent out, coming to Phoenix for an earlier appointment, or waiting for February 11th until those pharmacy options open for you, or really any of those. So I just want to present you with a couple of those options. If you do want to sign up, and this is for everybody, if you want to sign up and you haven't been able to, we talked about this at the beginning of the broadcast. I feel it's the most important thing for you to hear today. If you are still looking for an appointment, is that 21,000 of those spots are going to be opening up at 9 tomorrow morning. Please, please, please go log in and get your password and everything set up so that at 9 on the dot, you're ready to go sign up for an appointment, that you're not having any logon issues, because last time that's what we heard from people the most. So insider tip on how to get that going and be ready for it. So that's how you should get signed up. If you need any information that we didn't cover, it's on my Facebook page. You can find that at facebook.com news from Katie. There it is. And producer Carrie also just had the other information up on how to sign up for that pod.vaccine site, which is where you get your dosage. Garrett has the really good breakdowns happening every single day. We're not with you these next couple of days because we're on other assignments. And you can find his at Garrett_Archer. I've said it enough times, still can't say it. At Garrett_Archer. You'll find those in the morning hours. And then I'm on Twitter at Katie Ramos. So those are the spots that you can find us, and my Facebook account. We also have plenty of reporting. I talked about a lot of our stories coming up at 5 because I really think that they're interesting and helpful for you today. The heart damage story, and also the story on that Pinal County vaccination site that's being requested. So all of that coming up straight ahead. Our next newscast is at 4 o'clock in a matter of minutes. We also have 5, 6, 9, and 10 p.m. And then we invite you to find us on any of those other locations. A couple people asked about schools, and you can find that information there at abc15.com/schools. We haven't talked about that as much today. We will in our newscast because the state of education happened today and that public address came out. So there's going to be a lot more information on how we reopen our schools safely and how the state superintendent, Kathy Hoffman, hopes to do that. So lot coming up, a lot of talking. Hopefully that helps. Katie writes, thank you. When I can't watch on Facebook, I always watch on YouTube later. Yeah, they do post it over there. She writes, my family really appreciates all the information you guys share. Well, Katie, we appreciate you joining us here. This is why we continue to try to help everybody understand all these numbers. Carrie's writing, thank you. See you next week. Stay safe. Same to you, Carrie. In the meantime, everybody be safe out there, and we will see you, as Carrie mentioned, next week.